Good morning, everyone. Myself, Dr. Vikram Arora, Senior Lecturer, Department of Public Health and Dentistry from ITS Center for Dental Studies and Research, Murad, Nagar, Ghaziabad. Today, we'll be covering the topic Introduction to Indices and Clinical Demonstration of DMFT indices on the patient mouth as well as on the tooth model. So moving further, these are the contents which I'll be covering today. The objective, introduction, definition, ideal requisite of an indices, classification of an indices, criteria for selecting an index, clinical demonstration on DMFT along with the video, conclusion, suggestive reading, and references. So objective of my lecture, by the end of this lecture, you will be able to understand completely what you mean by indices and what are the clinical importance of an indices at the individual as well as on the community level. Also, by the end of this lecture, you will be able to understand exactly what do you mean by DMFT indices and what is its importance. Along with, I have attached a clinical demonstration video with that. So moving on to the introduction. So dental index or indices are devices to find out the incidence, prevalence and severity of the disease based on which preventive programs can be opted. An index is an expression of the clinical observation in a numerical value. So to be in a very layman term, the index simply means that if you have any dental disease, we can describe that disease in terms of numbers. So that is basically a layman meaning of the indices. So it helps to describe the status of the individual or group with respect to a condition being measured. Moving on to the definition, index is defined as a numerical value describing the latest status of a population on a graduated scale with definite upper and lower limits, which is designed to permit and facilitate its comparison with other populations classified by the same criteria and methods. It's given by Russell A.L. in 1969. So the index, as I told you before also, that in a very layman term, it is nothing but if you're talking about any dental disease, whether it is a dental caries, gingivitis, periodontitis, dental fluorosis, any dental disease, we can describe that disease in terms of numbers. So that is basically the very layman meaning of the indices. So what the definition says, so it is a numerical value which can describe the latest status of a population with a graduated scale. So we have the scale to record the severity of the disease. Like you can say that the person is having a 28 dental caries in a mouth, and on the other way, we have a patient with low DMFT scores. Like the patient is having only 2 dental caries. So based on that, we can describe the severity because we have a scale to record it. So moving further, onto the ideal requisite of an indices. So these are the ideal requisite of an indices: specificity, clarity, simplicity, objectivity, validity, reliability, sensitivity, acceptability, quantifiability, and specificity. So we'll describe all of them in detail. Moving further, so we have clarity, simplicity, and objectivity. Right now, I'm talking about indices. Any indices, as I told you, that we have a indices to record the dental disease, any dental disease. So today we're simply going to talk about DMFT, which will record decayed, missing, and filled teeth. So the examiner should be able to remember the rules of the index clearly in his mind. So basically, it should be very much easy and clear in his mind and very much simple to record. The index should be simple and easy to apply so that there is no undue time lost during field examination. So it should be very much simple, it should be very much clear, it should be very much objective. Moving on to the validity. So index must measure what it is intended to measure, and it should correspond with the clinical stages of the disease under study at each point. So we should know validity simply states that whatever you are gonna record, that finding has to be there in the patient mouth. Let us suppose that you're taking a DMFT index on a patient having no dental caries, no missing teeth, and no filled teeth. So it's of no point of taking an indices. So that is basically a validity. The index must measure what it is intended to measure. Moving further onto the reliability. So reliability is nothing but the reproducibility of your findings while taking the indices. The index should measure consistently at different times and under a variety of conditions. The term reliability is virtually synonymous with reproducibility, as I told you, which means the ability of the same inter-examiner reproducibility and different examiners inter-examiner reproducibility. That simply means if we are talking about here intra-examiner reproducibility, let's suppose that I'll take a DMFT index today Okay, and then again I will take firstly I have taken the index in the morning, then I again take the index at the afternoon, then again I take the index at the evening of a same patient. Okay, I'm talking about intra-examiner reproducibility right now. So that simply states whenever I am taking the indices either in the morning, afternoon, and in the evening, the outcome is the same, right? The DMFT score is the same. That is intra-examiner reproducibility. That means कि I'm taking an indices. So whenever and at whenever point of time I'm taking the indices, I got the same values. Okay, so that is intra. Intra, the basic difference between intra and inter means that I am taking the indices again and again and again. Inter means कि I'm taking the indices, then again somebody else will take the indices, then somebody else will take the indices, and we all get the same DMFT scores, right? So today I'm giving you an example of DMFT index because we are going to describe that index in detail, right? Moving further, onto the quantifiability. So all the whenever you're taking the indices, DMFT indices, we have a statistical measures also. So we can gather all the data that should be simply been converted into the statistical point of view. So in the index should be amenable to statistical analysis so that the status of a group can be expressed by a number that corresponds to a relative position on a scale from 0 to the upper limit. Moving further, onto the sensitivity, the index should be able to detect reasonably small shift in either direction in the group condition. Okay, so let us suppose that the patient is, if we are talking about here, about the plaque index. So you can see the diagram over here. We have a plaque disclosing agent which simply imparts the plaque here with a bluish stain over here. Okay, so that is basically plaque. That is a snap we have taken from the Tursky modification of Gilmore index. That is for recording the plaque index. Okay, so what is the role of the disclosing agent? It simply discloses the plaque present on the surface of a teeth. Okay, so that is what that picture says. So the sensitivity means the index should be able to record even the small shifts. Like if the patient simply brushes his teeth in a very good way, so it will be simply decreasing the score of that plaque scores. As we all of us know that it is a very simple layer that is again you can say can compare with the debris also. If you simply brush your teeth in a good manner, you will have no plaque. Okay, so we that index should be able to record even the small shift, whether it is a score of 1, whether it is a score of 2. Moving further onto the acceptability, it is very important point. Acceptability simply means that it should be able to record all the findings without harming the patient. It should be acceptable to the patient. Okay, the use of the index should not be painful or demeaning to the subject. In practice, no index or measure is wholly accurate, or probably no index used in oral epidemiology completely meets all these conditions. But the choice of an index in any given situation should be made on the basis of how closely the index approximates them by the requirements of the study in which the index is being used. So it should be very much acceptable to the patient. It should not cause any kind of pain, any kind of discomfort to the patient, so that he might object on the taking of an indices. Moving further onto the classification of an indices. Based upon the direction in which their scores can fluctuate, indices are classified as either reversible or irreversible. So as the name suggests, reversible index, that means the condition has been already been embedded into the patient teeth or gingiva. Here you can see with the help of a gingival condition. So if in a dental clinic the patient comes to you, if in a dental clinic the patient comes to you with the complaint of bleeding gums, right? So what it does is, it simply, if you simply do the scaling in a very good way, the gingival disease can be reversed, right? So that is basically a example of reversible index, that the condition can be reversed, like gingivitis can be reversed, right? If we have if you're talking about irreversible indices, like if the patient is having a dental caries, it can't be reversed. Okay, so it is an irreversible index because that condition can't be reversed back. So moving further, depending upon the extent to which areas of oral cavities are measured, full mouth indices like OHI index, in which we have to record all the teeth, all 32 teeth. Whereas if we simply talk about simplified index, we have only 6 index teeth in OHIS. So OHI is an example of simplified index in which we have to record only 6 teeth. We have to record only 6 teeth with a particular surface we have to record in OHIS index. Moving further, indices may be classified in certain journal categories according to the entity which they measures like disease index. D is the negate portion in DMFT. Symptom index measuring gingival bleeding. Treatment index we have a filled in DMFT index. So we have what we have in DMFT indexes, we have decayed teeth, we have missing teeth, we have filled teeth, right? We have these three conditions in which the diseased index is the D1 of DMFT. And if you're talking about treatment index, we have F, which is the filled component of DMFT index. If you're talking about symptom index, that simply states, as the index name states, symptom index, that is basically the gingival bleeding. Moving further, decayed portion of the DMFT index must best exemplifies a disease index. The index measuring gingival circular bleeding are essentially symptom index. F filled portion of the DMF index best exemplifies a treatment index. Moving further, on the dental indices can also be classified under special categories as simple index, index that measures the presence or absence of a condition, an index that measures the presence of dental plaque without an evaluation of its effects on gingiva. That is a very much simple index. And cumulative index means that index measures all the evidence of a condition, past and present. Example, DMF index of dental caries, because the patient might be having a dental caries right now. He might have a missed teeth which has been gone extracted few years back also, and got some teeth which have been filled in by few years back also. So that is a cumulative index which simply measures all the evidence of a condition, past and present. So DMFT is the best example of it, of a cumulative index. Moving further, criteria for selecting an index. Index should be simple to use and calculate. The calculation should be very much simple and very much easy to calculate. The index should permit the examination of many people under a short period of time. It should not take much time. It should not be time consuming, because if the index is time consuming, we can't record it on a larger population within a small time frame. Moving further, the index should require minimum armamentarium and expenditure. The instruments which we can use should be very much less and should be very much of the clinical importance. And the expenditure also, like whatever the things we are using while measuring the index, should not be very much of cost. The index should be as free as possible from subjective interpretation. Moving further, the index should be clear and readily understandable so as to promote maximum intra and inter-examiner reproducibility and standardization. So intra and inter-examiner reproducibility, as I already told you, that if I am taking the index again and again and again, the values which I got from my index recordings, that is intra, and if I am taking the indices, you people are taking the indices, the other people are taking the indices, so all of them contribute to form inter-examiner reproducibility and standardization. The index should define clinical condition objectively. Moving further, the index should be highly reproducible in assessing a clinical condition when used by one or more examiners. The index should be amenable to statistical analysis. Whatever the things you are taking the record of a patient, that should be easily embedded into the statistical software to get the result of a particular importance. Moving further, the index should be strongly related to numerical to clinical stages of the specific disease under investigation. The index should be equally sensitive throughout the scale if it relates to the severity of a variable. The index should not cause discomfort to the patient, as I told you earlier also, and should be acceptable to the patient. It should not cause any kind of discomfort and harm, as I told you in the ideal of it. Moving further, uses of an index. When used for individual, an index can provide individual assessment to help patient recognize an oral problem. Individual assessment, the best example here is the oral hygiene index simplified. So that is simply to assess the oral hygiene status of an individual. So if you simply brush your teeth in a very good way, right, so the debris and plaque and the calculus will not accumulate. Based on that, you will get a score to simply calculate your oral hygiene assessment. So reveal the degree of effectiveness of present oral hygiene practices. like if I'm taking the OHIS index of me or of any patient, that simply states that how effectively I'm taking tooth cleaning design in a good way. So motivate the person in preventive and professional care for the elimination and control of oral disease. Evaluate the success of individual and professional treatment over a period of time by comparing index scores. So moving on to the decade missing filled teeth index, that is DMFT index, which is given by Knudsen JW, Henry T. Klein, and Caroli Palmer in the year 1938. As I told you, is an irreversible index, as I told you in the classification also, because these conditions can't be reversed back. Okay, whereas in reversible index, we have gingival index where the condition can be reversed. So if the patient is having a dirty teeth, you can simply do the scaling of that patient. Okay, if the patient is having gingivitis, you can simply do the scaling, subgingival scaling of that patient, and the gingivitis, that is a condition which can be reversed. That is the best example of reversible index. Right now, I'm talking about irreversible index, which is DMFT. Moving further onto the procedure, how to record it. So DMFT, as the name suggests, D simply stands for the decayed teeth, M stands for the missing teeth due to caries, and F used to describe teeth that have been previously filled. The instruments used are number 3 plain mouth mirror, fine pointed pigtail explorers. So all the 28 teeth are examined in DMFT. Teeth not included are third molars, unerupted teeth, congenital missing teeth, and supernumerary teeth. Teeth removed for reason other than dental caries such as orthodontic treatment or impaction, because they are not lost due to caries. So as I told you that we have to simply take missing teeth due to caries. So if we have a missing teeth due to the orthodontic treatment or impaction, that can't be counted in as the missing teeth. The teeth restored for reason other than dental caries such as trauma, abutment, etc. Primary teeth retained with permanent successor. So criteria to identify caries. So first of all, we can simply say that whenever you are talking in terms of dental caries, first of all, the thing which you simply see is the discoloration on that particular tooth. Okay, that is simply the loss of translucency typical of demineralized and undermined enamel. Catch at the tip of the explorer. Okay, so you can simply have a catch at the tip of explorer. Explorer tip can penetrate deep into the soft yielding tooth mirror. It should be soft at the base. Always remember that. And again, if you are not able to recognize it, you can take a radiograph of it as well. We have a IUP also, intraoral periapical radiograph. Based on that, we can simply come to the conclusion, because there are so many caries which are proximal, like in a mesial or a distal direction. So we can't have it with the help of an clinical eye view. Moving further, rules of DMFT. No tooth should be recorded more than once, either decayed, missing, or filled teeth. Decayed, missing, and filled teeth should be recorded separately. Secondary caries below the filling should be counted as decayed. Teeth missing only due to dental caries should be counted as missing. As I told you, in case of orthodontic treatment and impaction, we can't say that the teeth are missing. Moving further, a tooth which is restored separately on different surfaces should be counted only once as filled tooth. Deciduous teeth should not be counted, because it is only in a case of a permanent teeth we can have that thing. A tooth is considered to be erupted when the occlusal surface or incisal edge is totally exposed. A tooth is considered to be present even though the crown has been destroyed and only the roots are left. Okay, so these are the conditions which you have to take a brief emphasis on that. So this is the recording format of it, of a DMFT index. You can see here the boxes. So we have around 28 boxes here. We have a first quadrant, second quadrant, third quadrant, and fourth quadrant. Okay, so based on that, in those boxes, we can simply allot DMF. And how to calculate it? Simply, you have to simply add all of them to take a DMFT score. So calculation of an indices, maximum score of DMFT of an individual is 28 or 32. In case we are taking the third molars also, then it comes to be 32. Otherwise, it is 28, because we have 28 teeth apart from last teeth, last permanent molar. So individual DMFT, take each component D, M, and F separately and then total it. Okay, so as I told you, again, I'm going back onto the recording format. So if you have, like, suppose you have a D component in 16 and 17, D component in 26 and 27, 3637 you have missing, and 4647 you have missing. So we have four dental, we have four dental caries teeth, okay, and we have four missing teeth. So it comes out to be 8. Moving further, the advantages of taking a DMFT. The index has gained worldwide acceptance for its versatility in assessing dental caries. DMF index has been the primary outcome measure by which relative efficacy of various caries preventive agents have been demonstrated in clinical trials. So, if you're talking about dental caries and if you're talking about the researches which are going on about dental caries, we have so many researches in which how to record dental caries. We have taken the DMFT scores. So the index is sensitive enough to detect difference in relative efficacy of a worldwide variety of fluoride delivery system, including water fluoridation, fluoride mouth rinse, fluoride oral prophylaxis, and fluoride dentifrices. So limitation of DMFT index. DMFT values are not related to the number of teeth at risk. So the teeth which are at risk can't be counted in a case of DMFT index, in a case of recording a DMFT index. So DMF can be invalid in older adults because teeth can become lost for reasons other than the dental caries also, as I told you, in a case of orthodontic treatment and infection. Okay, so you can simply record the missing teeth only in a case if they missed due to dental caries in DMFT index. So DMF index can be misleading in children whose teeth have been lost due to orthodontic treatment, as I told you. DMF index can overestimate caries experience in teeth in which preventive filling have been placed. So DMF index is of little use in studies of root caries. Now moving on to the decade missing field surface index. Now we are the authors are the same in a case of decade missing field surface index. So initially we talked about DMFT index, now we are talking about DMFS index. So the difference between them is now we are recording the surfaces also. Always remember one thing, if you're talking about posterior teeth, okay, if you're talking about posterior teeth, we have 5 surfaces: the mesial, distal, buccal, lingual or palatal, and occlusal. And if you're talking about the anterior teeth, we have only 4 surfaces: mesial, distal, buccal, and lingual, or the palatal. Okay, so these are the things. Again, we have Henry D. Klein, Caroli Palmer, and John W. Knudsen, given in the year 1938. Principal rules and regulations are the same as that of the DMFT, except in this the surface are examined, as I told you. So the simple clarification of it. So we have anterior teeth, canine to canine. If you're talking about the upper teeth, we have 40. If we are talking about the upper and lower canine, so we have 6 anterior teeth in the maxillary compartment and 6 anterior teeth in the mandibular compartment. So if we are talking about the surface of it, we have 48 surfaces. So if you're talking about posterior teeth, we have 8 in the maxillary compartment and 8 in the lower compartment. So we have 5 surfaces also, as I told you. So that comes out to be 80 surfaces. Okay, so if third molars are also included, we have 4 third molars also. The surface comes out to be 20. Okay, so maximum DMFT index is DMFS index is 148 because we have 148 surfaces if we are talking about in the case where we are taking the third molars also. So for permanent dentition, the maximum score of DMFS index is 128 if we are talking about only 28 teeth. In these conditions, the third molars are excluded, and if we include the third molars, we have 148 surfaces for the 32 teeth. Okay, so for the individual DMFS, we have a D, M, and F. We have to simply sum up all the surfaces to get the DMFS scores. So this is the recording format. Okay, so again we have a simple recording format of it. We have to simply calculate it. We have to simply add all the surfaces. Today I will tell you how to record DMFT index in the patient mouth. First of all, you need to know it's given by whom. It's given by Henry T. Klein, Caroli Palmer, and Knudsen J.W. in the year 1938. So before proceeding further, what is the need to take a DMFT? You should
be knowing it that we used to take DMFT index just to record the prevalence of corneal caries. Let us suppose that you want to take a prevalence of dental caries in the Ghaziabad district. So what index you need to have? You need to have DMFT index with you. So as the name suggests, DMFT index, these are having three components. The first component is decayed component, as the name said D. M is the missing component and F is the filled component. Now moving further, you should also know that while recording the dental caries, you need to have four things in your mind. The first thing is it should be clinically visible and obvious. The second point is it should have a discoloration. The third point is it should have a catch, okay, at the tip of an explorer when you are going to check it in the patient mouth. The third point is you can even have a radiographic evaluation for it to check it whether it's having it or not. So I will start from the 1/8, move forward to the anteriors, then I'll move to the second quadrant, the anteriors, then to the large teeth. Then I will record the distal teeth of a third quadrant, moving further to the anterior teeth. Then I'll record the fourth quadrant anterior teeth and moving further to the posterior teeth of the fourth quadrant. So it is a full mouth index. We have to record each and every tooth over here. So that's it for here. The second component is the missing component. As I told you that we need to check four things for the dental caries. So if the patient is not having a teeth in his mouth and it is absent due to dental caries, you can record it as a M component. Moving further, we have a F component. So as a F component, it simply states a normal filling. The patient can have a filling of amalgam, can have a filling of a miracle mix, can have a filling of GIC. Okay, so any permanent restoration or composite you can say. So if the patient is having any kind of permanent filling, that can be recorded as F component. So here you can see the patient mouth. और करो भैया बड़ा, ठीक है, ऐसे ही बैठना है आपने, हिलना नहीं, ठीक है. So initially I will record the first quadrant, the posterior teeth of the first quadrant. So here you can see, right, now it's visible. Okay, you can see here, is it visible now? Okay, so it is 1/8. We don't have any catch, we don't have any discoloration. We have a discoloration here, but these are the extrinsic stain. There is no catch over here. Okay, moving further to the 1/6, we don't have any catch over here also, but we do have extrinsic stains here. Moving to 1/5, is visible? Okay, moving to 1/5, 1/4. There are only extrinsic stains, but there is no evidence of catch here. As I told you initially also that there should be a catch whenever you are going to check for the dental caries. There are 4 requirements that need to be filled. Okay, moving further to the anterior teeth, we have only extrinsic stains. That is nothing to do with the DMFT indices. So here you can see here again, in the anterior teeth, we have only extrinsic stains here. We don't have any kind of catch. You can see there is no catch. There are only extrinsic stains here, and we can move further. Then moving to the third quadrant. आकर ये पड़ा, ठीक है. Is it visible now? Okay. Moving on to the third quadrant. ये लास्ट वाला टीथ निकला था आपका, कब निकला है?
ये हो गया,
1 साल हो गया. दांत में कीड़ा लगा था?
दर्द है.
ठीक है, ठीक है, ठीक है, ठीक है. Okay. So here you can record number 8 teeth as a miss under the M component because the teeth has been missing due to dental caries. Moving further to 3/7, we can't have anything here. So here you can see a catch. So and you can see a normal probe, a WHO probe, and you can see here that the ball and tip of a WHO probe is being embedded into the lesion, and we have a catch here. Okay, so that 3/6 comes under the D component. Okay, moving further to the anterior teeth. So we don't have anything here in the anterior teeth of our mandibular teeth. They are all clean, and we don't find any kind of a catch or any kind of a discoloration. here, all the discoloration in the patient's mouth are just due to the extrinsic stains, and that is nothing to do with the DMFT indices. Moving further, we have a fourth quadrant with us, and this 4-6 teeth is again missing. ये वाला दांत भी निकलवाया था, दांत में कीड़ा लग गया था. Okay, so here the patient said that it has been missing. It's been missing due to dental caries. It's been missed. Again, moving further, here you can see the WHO probe here, and you can see over here. Okay, I need to just have a proper dryness here. Okay, so here what I need to have is I have to simply acrobia bada. ठीक है. Here you can see the ball tip. Here you can see the ball tip here of a WHO probe. It's been totally engaged into the lesion, and there is a catch, and it is soft at the base, so we can record it under the D component. Again, at the last stage, we don't have any catch. In forehead भी आँख रो बड़ा, ठीक है. We don't have any catch here. We don't have any discoloration here. So this is how we record the DMFT index. And now I will tell you the normal calculation of it. How do we simply calculate it? Okay, moving further. That is the calculation here. So as we can see over here, we can see in the patient mouth that the two teeth are missing, and the two teeth are having a catch, where you can see a normal WHO probe has been, the ball and tip has been totally engaged into that lesion. Okay, so how to record DMFT? So we have two decayed teeth, we have two missing teeth, D is equal to 2, M is equal to 2, the total DMFT comes out to be 4. So here is the DMFT teeth. And now moving on to the DMFS, it is a decayed missing filled surface teeth. Okay, so here again, if we see 3-8 in this, we have 5 surfaces. Okay, so before going further, I will simply tell you that how many surfaces we need to check in the DMFS index. So these are the total surfaces. We have 5 surfaces of a posterior teeth. These are the 5 surfaces of the posterior teeth. It is a medial surface, it is a labial surface, it is a lingual surface, palatal surface, and the distal surface, and the occlusal surface. So if we are talking about the posterior teeth, we have 5 surfaces of posterior teeth, and if we are hereby to check the anterior teeth, we don't have occlusal surface. So here we have only 4 surfaces. 4 surfaces. Okay. Moving further. So now we have 1, 2, 3, 4, 5. 5 multiplied by 4 quadrants. Okay. So we have 20 posterior teeth in the patient mouth. Okay. There is a normal total surface that we need to check in the DMFS indices. These are the normal posterior teeth. There are 20 teeth and we have 5 occlusal surface. So we have to check 100 surfaces of only posterior teeth. And if we want to check a normal anterior teeth, we have 6 anterior teeth in the maxillary quadrant and we have 6 permanent teeth in the lower compartment. So here we have 12 teeth and we have 4 surfaces. So we have to check 48 surfaces in the anterior teeth. So the total comes out to be 148. We need to assess 148 surface in the complete DMFS of a patient. Okay, so here in that case, you can see over here, it is missed. So it is missed 1, 2, 3, missed, and it is missed. Okay, moving on to 3, 6, we can see over here, we have again 5 surfaces. Here also, that is decayed. Okay, so here you can see in the patient mouth that we have only occlusal surface that is being decayed. So only occlusal surface has to be marked. Other surfaces are not hereby to be marked. Okay, moving further, we have 4, 6 that has been totally missed. So here we can mark M. We have 5 surfaces. Here we have only occlusal surface that comes out to be 1 only, 5 only in the missing. And if we are talking about, and if we are talking about 4-7, only occlusion surfaces was D. Only one surface is been marked as D. So DMFS score comes out to be 5 plus 1 plus 5 plus 1. It comes out to be 12 surfaces as a DMFS score. Okay, if we are talking about DMFT, we have only 1, 2, 3 and 4, only 2 decayed teeth as I told you earlier, and 2 missing teeth we have, so the total comes out to be 4. So the DMFT comes out to be 4 and the DMFS comes out to be 12. That's it for the DMFS.
Okay, that's the video for the DMFT index. Now moving on to the conclusion of it, DMFT index or devices are the other devices to find out the incidence, prevalence, severity of the disease. Incidence is basically nothing but a new number of cases that has been reported to the dental caries. Prevalence is, let's suppose that if you're going in a class of 100 people and you have seen over there that 60 people are affected from dental caries, so the prevalence comes out to be 60. And if again you go to the class after 3 months, you have seen that 2 more cases have gone dental caries now. So the incidence become 2 and the prevalence becomes 62 at in this case. And the severity of the index also of the disease based on which preventive programs can be opted. The index is an expression of the clinical observation in a numerical value, as I told you in a very layman term. It helps to describe the status of the individual or group with respect to a condition being measured. Emphasis should be given that it meets all the criteria. So these are the suggestive rating for the UG people, undergraduate students, the reference. These are the frequently asked questions, multiple choice questions. Thank you for today.